Our next component of the second line of defense is inflammation. So any type of damage that is done to the body's tissue is going to trigger a very localized defense response that we call inflammation. Right? When cells die in unnatural ways, such as if you cut yourself with a knife, you cut through the skin, you've shredded the cells, bacteria that has now been introduced, and there might be waste products from the bacteria inside of there as well, inside that wound. So all this and the components of the cell that have now, of your own cells that is, that have now been kind of spilled to the outside when you've cut them, all this is a cause of concern for your body, and it's going to trigger inflammation. So inflammation has the following functions. It's there to destroy any agents or pathogens that could be now introduced into your body. So not only to destroy, but also to remove it and any byproducts from it. We want to be able to limit the effect on the body. So we want to confine or wall that site so that the pathogen may not be able to get any further. And we want to repair and replace any of the damaged tissue as well. Inflammation is usually characterized by 4 signs and symptoms, which you got to know. Very important. And up here we have them based upon the Latin terms that are used for them. So we've got dolor, which is pain. So usually there's pain at the site. Tumor, which is swelling at the site of inflammation. Rubor refers to redness. Color refers to warmth. So this is not that you have a fever. That's not what this is referring to. It's referring to that the area where the inflammation is occurring is warm to the touch. All right. And sometimes there is a 5th symptom, and that's loss of function. It just depends upon the site at which this is occurring and the extent of the damage that has been done, whether you have loss of function. But all these are signs of inflammation: the pain, the swelling, the redness, the warmth. All right, so these are things that you would be asking a patient if they are experiencing any of these things. So inflammation, let's look at what happens. So early inflammation is usually characterized by some vascular changes. So we have the area being very vasoactive. So if there's undamaged blood vessels, they may increase in diameter, so there's more blood flow going to the injured tissues. There could be the release of cytokines, and that could be coming from damaged cells in the area or from any white blood cells that are in the area before the damage occurred. And so this is all going to help to attract reinforcements, more help, right? Kind of stimulate your immune response. So we'll find that there's vasodilation occurring. So your blood vessels will increase in size for a little bit, and then they'll decrease again, and then they'll increase in size, and then they'll decrease again. And it's thought that this is kind of like a flushing action that might help to flush away some of the bacteria from the area. And then eventually it's followed by a kind of long-term dilation, and that's helping to bring the white blood cells to the area. So immediately you might kind of get this kind of flushing response with this vasodilation and constriction, and then finally it's replaced with the vasodilation to help bring the reinforcements to the area. So because of this vasodilation, right, and stimulating the blood to kind of enter the affected area, the area is going to look kind of warm and some of our signs and our symptoms that we were talking about there for inflammation. We also have what's called diapedesis, which occurs, and this is when white blood cells move through the blood vessels to the infected site. So these are the backups that is coming. So the leukocytes will actually adhere to the vessel wall, change shape. And this is that process of diapedesis where they kind of then squeeze through the blood vessel walls, and they're attracted by the cytokines that are released in that area. So they're kind of following that chemotactic trail. And so in the blood vessel, they're going to pick that up and they're going to squeeze through and take it to the site where the damage is. We also have what's called exudate. So when the vessel permeability increases, the vessels become kind of leaky, and that allows blood plasma and the proteins that it carries to enter the tissue. And so this fluid, this blood plasma, is called exudate, and it tends to accumulate in the tissue. And the proteins that are in the exudate kind of help to finalize any blood clot formation if that's needed, if you cut yourself. And they can also help to signal other molecules as well. So the exudate basically causes the swelling that occurs, and the swelling is what we call edema. Right. Here they're showing the diapedesis. You're looking at the blood vessel here, and we've got neutrophils, which are kind of moving through the blood vessel, and they'll actually kind of roll along the wall here, and they start to adhere to the wall where they find an area where they can cross over. And then they start to change their shape as they squeeze through that opening. So we said the blood vessel, the lining of the blood vessels tend to become leaky, and that allows for these neutrophils to squeeze past, but also some of the blood plasma to leak out as well. And here's these little kind of star-shaped things are referring probably to cytokines, which is our chemotactic field kind of directing where these neutrophils should be going. And then amazingly enough, they've kind of captured an image here that actually shows neutrophils squeezing in between the openings in a blood vessel, which is just an amazing. So we said we have this exudate that's starting to accumulate all this fluid that's accumulating in the area, and that's going to cause edema. All that edema generates pressure, and that can then activate pain receptors. So once it starts swelling, you might also start feeling painful because of. You can also have pus formation. So we saw that the neutrophils were the ones that were kind of squeezing in between the blood vessel lining there. So certain bacteria, the streptococci, the staphylococci, gonococci, and meningococci are, they will attract neutrophils. And so these bacteria are called pyogenic because they tend to produce pus. And we already said that pus is mainly dead neutrophil cells. So to attract a lot of neutrophils, and that can lead to pus buildup. And if the cause of inflammation is resolved in a relatively short period of time, everything kind of goes back to normal. Fluid goes down, the swelling decreases as the exudate is collected in the lymphatic capillaries. Site has been cleared by our phagocytic cells, and the number of leukocytes is then going to start to decrease, and the blood vessels are going to go back to their normal state. Right? If there's a cut or something, then that tissue will have clotted, and new tissue will start to form. There might be scar tissue formation, once again, depending upon the what has occurred.